Hi, folks. On a spring-like day like today, hope springs eternal, and that has to do with the pandemic as well. So for the latest on the cases, the variants, and the vaccines, we went straight to the source, Dr. Janet Memark. She is the director of Cobb and Douglas Public Health. She says the trends have been looking good recently, but there are still some worry spots.
So the good news is cases continue to fall. So we are down to 267 cases per 100,000 for PCR, but you add in those antigens and we're at 394 still. So what's important to take away from that is we're still very high on those numbers, but they are coming down. Hospitalizations too, got some pleasant surprises. They continue to come down today as well, our area hospitals in the county, so they're coming down as well. So we'll switch over to some of the bad news. Deaths keep coming in, and we still hit some highs last week as well. We had 881 deaths due to COVID, and you may know the national statistic that we're hitting 500,000 deaths from COVID probably sometime today. What's still lurking out there is the variants. So we continue to increase those numbers and the variants. So remember that they're more contagious and possibly more deadly. What we have in Georgia is the UK variant, and that's also in both of our counties as well. We added more to that number, and those are expected to double every 10 days if something doesn't drastically happen.
And Dr. Memark tells me no South African variant has shown up so far yet in Cobb County or the region. Things are going in the right direction, but there are still some things in the future that have her worried.
I feel like our celebrating is always precarious with COVID-19. It always seems to find a way to make a comeback somehow or another. So what we're watching is definitely watching the variants to make sure the variants do not take hold in the community and start taking off. The other thing we're watching is the break. I saw a lot of people that were traveling over the break and gathering, a lot of families that were gathering. We're hoping it does not have a big impact, but we'll see that in the next week or two if we get a lot of cases from that.
Judging from my email inbox, the big concern that a lot of folks have is, of course, about the vaccines, especially for that group 65 and older. They want to know, are vaccines available? When will they be available? If you've been watching the news, you know that deliveries because of weather and other factors have been delayed to many places. That includes here in Cobb County. They've had to cancel taking new appointments. There is, though, some hope on the horizon.
Last week, we had received notice because of the weather situation that vaccines would be delayed. So we did receive a very small amount of first dose vaccines, which we ultimately had to use to get some of these second vaccines into arms. But we have delayed last week's second dose vaccines, and then now we're getting some for this week. So we should get a nice number of vaccines this week. They'll be mostly second dose, but we have not received the shipping information yet. So we have kind of a verbal notification, but we have not seen the actual shipping label, so we don't know. They said it would be sometime this week. So we anticipate getting in our second doses for this week and next week, and then we'll add on some new doses as well, the first doses, as soon as we get vaccine in hand.
That leads to obviously a lot of frustration. Many that are 65 and older believe they should be able to get the vaccine. Some have compelling health reasons to do it, and Dr. Memark says really it's out of their hands for now. They're just hoping for better times ahead.
It's very frustrating. I totally understand. We are at the mercy of the federal government as well. I've gotten questions like, why didn't you hold back the the second dose vaccine? And that's not what we were instructed to do. We were instructed to get vaccines into arms, and so they don't allow you, if they see that you're holding on to vaccine, they're not going to give you more vaccine. And so that's the trick to all of this. And so we've had to use the vaccines and get them, and we really have tried to minimize. We had to reschedule Saturday and today, but we only had a few that were scheduled for today, and tomorrow we have a very few, so we're not even going to move those. Just go ahead and do those. It's like 50 people that we're doing, and then we're hoping as soon as we get more vaccine, we can add on a bunch more appointments.
A lot of folks are concentrating on the vaccines being given out at the Jim R. Miller Park mass vaccination site that's being run by Cobb and Douglas Public Health. But Dr. Memark says the vaccines being distributed there, really only a fraction of all the vaccines being given out in Cobb County. And there's an easy way how you can find those other locations.
I think one of the difficult things is when you look at our vaccine, vaccine dashboard from the county, we are actually accounting for, we have 26,000 vaccines, which is not even 25% of total vaccines that are given in the county. So we're actually a fairly small percentage of the number that's being given out. So when you take a look at that, there are other places to definitely get your vaccination. So the things that we're hearing, so this week, I think starting today, the federal government will be sending vaccines to pharmacies. So my understanding is that Kroger and Walmart will be part of that for Georgia. That's a completely separate allocation of vaccines that will go for the public. And then also today, GEMA, which is Georgia Emergency Management Agency, they opened up 4 mass sites today. And so you can go on to myvaccinegeorgia.com. You can register. And the nice thing about this is you don't have to be eligible right now. So they will take you on a waiting list, and they'll also add you. So when your eligibility comes up, they'll ask you the appropriate questions. And then when it comes up, they'll contact you and put you on the list. So they are doing what sounds like about 1,000 per day per site. So there is some eligibility. The sites were Albany is one of the sites, and then we have Macon, and then the Clayton Delta Museum, and then Habersham. They can all take appointments on that site for you. So myvaccinegeorgia.com.
And by the way, on that website, that list continues to grow, so check it often if you're looking for a potential place to get your COVID-19 vaccine. One of the big questions that we've heard in the news lately is, after you get that first dose, do you really need that second dose, especially if you've had COVID? Well, Dr. Memark says right now, get that second dose.
So it's a great question. So we have not been instructed to delay the second dose at all. There is some question that you may have 80 to 90% plus efficacy just from that first dose. But the issues is that when the studies were done, it was not done on just the first dose. It was done with having the second dose that would come kind of to booster that. And so the other thing, so we can't really stop and not do second doses right now unless the FDA and federal government feel that that's what we need to do to protect the society as a whole. But right now, that's not what we're doing. The other thing I want to remind folks is that 21 days for Pfizer and 28 days at Moderna are the recommended time intervals. Now, you do not have to get it done on those days. So I've gotten some emails from folks that it's 28 days or bust, and that is not how it works, especially if something like this weather delay happens. We try to put in enough padding in there so that we can get it in there comfortably, but it does not have to be at 28 days. You have 42 days for both of those vaccines to get folks vaccinated. And even there's some folks that had to miss for some reason or other. You could get sick, or you could get quarantined, or something can happen, right? At that point where you cannot get that second vaccine. If you pass the 42 days, you're gonna be okay. The recommendation is to go ahead and get the vaccine as soon as you're able. You don't have to restart the series. We definitely have some hope that vaccines will be coming in at a brisker pace. And so it's not going to be right away, but over the next few weeks, they have been increasing it a little at a time. So you can already see in the state of Georgia that we've had some increases in vaccine allotment, that, the mass sites will get them, different areas will get vaccines. Now, what I really do believe in is that we are ready to go when vaccines roll out quicker. We have over 2,000 authorized providers, and we have the ability to ramp up mass vaccination sites and to go to max capacity if necessary. The goal is to vaccinate as many people as possible in the quickest time frame. And I think a lot of us are preparing for the 1B rollout when it gets opened up to most of our population. So, I know it's been a long time, but it is, we're getting there, right? We're just making some, a little chipping away at this, and it will open up. But in the meantime, I need everybody to hang on just a little bit longer. We've got to continue to be able to wear our mask and to not gather with a bunch of folks, and try to keep your distance, hoping that warm weather will help. But please don't forget these things and throw caution to the wind, because we're almost there. And like many of you, I don't want to go through another surge. And so let's all work together to get to the end here.